These new COVID-19 XBB 1.5 vaccines are made by Moderna and Pfizer, and health authorities say that they have shown modest protection, improved protection against the subvariants of Omicron that are currently circulating in the community. Now, the Pfizer vaccine is going to be available for all eligible people aged 5 and over, while the Moderna vaccine will be available for those aged 12 and over. And health authorities say that if you've already had your 2023 dose of the vaccine, then you don't need to get another one, because that will provide enough protection against the most severe forms of the disease. However, Mark Butler, the health minister, says that while we are no longer in that emergency phase of the pandemic, it's still important to remember that COVID-19 is present and you should do what you can to protect yourself.
Steph, we know that cases in the community are rising. A lot of us know many people who've had COVID recently. What signs are there on what is happening with this wave?
Yes, this is certainly, Emma, the Christmas present that you don't want, isn't it? However, unfortunately, COVID health authorities around the country are bracing for yet another COVID Christmas. And it is a little bit more difficult to work out exactly how many people out there in the community have it, because we don't have the same sort of reporting mechanisms that we used to during the heights of the pandemic. However, what we do know is that we have seen hospital numbers, even though they dropped slightly since the start of November, that general trajectory has been going up since June. And also we've seen outbreaks among aged care homes as well, like the one we saw recently in Northern Territory. They are also on the rise. Now, we've heard from Professor Brendan Crabb, who's the head of the Burnett Institute and also an infectious diseases expert, and he says that there's probably around a couple of 100,000 people walking around the community at the moment with COVID-19. And if we don't do anything to actually prevent this wave continuing on, then we could see at least 3 million by the next three months or so having COVID. So he says that it's really important to take those necessary steps, particularly because for some people, COVID isn't a simple sniffle. It can lead to long COVID as well. And so he says that what the real concern is that underrepresentation in vaccines, particularly among those vulnerable over 75s.